Are you struggling with chronic pain? And has pain taken over your life? Are you ready for some relief of pain without medications, interventions, or surgeries? Then you're in the right place, as this is the place where you will get hope that is evidence-based without any cost. Hi, I am Dr. Sharna Prasad, a physical therapist, a therapeutic pain specialist, and lifestyle medicine certified professional. I am trained in acceptance and commitment therapy. But beyond my qualifications and credentials, I am someone who deeply understands pain, not just as a clinician, but through my own lived experience. My vision is simple, yet profound, to empower anyone in pain to heal, grow, and thrive. I have had the privilege of walking alongside countless individuals navigating complex chronic pain. Each story I hear is an honor to witness, and I'm continuously humbled by the resilience and the courage of those who invite me into their healing journey. Their strength fuels my passion, and their victories inspire my work. Some of their stories are shared through the Oregon Pain Science Alliance, a nonprofit created by patients and providers with the goal of improving our community's understanding of pain. I am incredibly proud of their dedication, grit, and unwavering hope for our community and country. Before we begin, I want to acknowledge that the information I share in this platform is for educational purposes only. It is not a substitute for individualized treatment, and I encourage you to consult with your trusted healthcare provider for personalized guidance. What I share here reflects my personal interpretation of the science and how I have implemented it in my practice. Pain is complex, deeply personal, and often misunderstood. Despite remarkable advances in pain science, there is still much to uncover. My goal is to share what we do know in a way that is compassionate, accessible, and empowering, so that you can use this knowledge to work with your pain coach or healthcare provider to take back control of your experience. As part of my work, I often refer to the pain management guidebook compiled by Matt Del Brocco, also known as Honest Physio. Their user-friendly resource simplifies the science of pain in a way that is engaging and easy to understand. While there are many resources available, this is one I highly recommend and I use. You can download it for free from my website, solace.com, spelled SOL 4CE. So let's begin. Your pain is real. If you've ever been told there's nothing wrong with your X-ray, CAT scan, or MRI, or worse, it's all in your head, I want to take a moment to acknowledge and apologize on behalf of anyone who has dismissed or invalidated your experience, whether it was a clinician, a friend, or a family member. I believe you. Your pain is real, without question or condition. You deserve to be heard, understood, and supported. If you are hurting, we see you. You are not alone, and we are here to walk beside you. So what is pain? The International Association of the Study of Pain, the IASP, defines pain as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Let's unpack this. We can all agree that pain is unpleasant. If it weren't, it wouldn't be pain. But pain is more than just a physical sensation. It can also be emotional. It can bring fear, frustration, anger, sadness, or even helplessness. Pain is an experience shaped by our thoughts, emotions, and circumstances. No two people experience pain the same way, even if they have the same diagnosis. The second part of the definition is especially important. Pain can exist without actual tissue damage. This can be a difficult concept to accept, not only for those in pain, but also for healthcare providers trained to look for objective findings. If they can't find a clear cause, they may feel helpless, leading to miscommunication or dismissal. But science continues to evolve, and we are learning more about pain every day. I'm going to tell you my story. About 10 years ago, I experienced excruciating pain. It was in my low back with no obvious injury. Fear took over. I worried it could be something serious like cancer, but I hesitated to seek help. I felt like I should know how to manage it as a physical therapist. Doubt crept in. I questioned myself, my profession, and everything I had learned. That experience became a turning point. It led me to deeply study the science of pain, shifting the way I understand and treat pain today. I now know that pain is influenced by so much more than just tissue damage, and that knowledge gave me the power to heal. All pain is pain. Pain has many contributors, not just causes. Words and beliefs can amplify pain. For example, hearing phrases like, "You have the worst back I've seen in 40 years," or "You'll end up in a wheelchair," can instill fear, which in turn intensifies pain. Similarly, emotional and mental stress can manifest as physical pain. I have seen this in myself. After a long and stressful trip, I developed severe low back pain upon returning home. But because I understood the science, I avoided a trip to the emergency room and managed my pain with self-compassion and knowledge. The brain's role. Pain is not just a response to injury. It is the brain's interpretation of sensory, emotional, and environmental inputs. In other words, pain is an output, a response to everything happening in and around us. There is hope. Here is the most important thing I want you to know. Pain can change. You don't have to live with chronic pain for the rest of your life. Just as the brain can learn a new skill, like playing an instrument or speaking a new language, it can also learn to process pain differently. Through neuroplasticity, the brain's ability to form new connections, we can influence how we experience pain. Your brain is adaptable. With time, education, and the right support, it is possible to reshape your pain experience. In summary, your pain is real. No one can take that away from you. No one. All pain is pain. It is influenced by many factors, and so no two experiences are the same, even though the diagnosis may be the same. Pain can change with knowledge, support, and self-compassion. Healing is possible. Thank you for trusting me to walk this path with you. Together, we will explore the complexities of pain and discover skills to help you reclaim a life of meaning, purpose, and vitality. Thank you.